All right, so you guys have sent us a ton of notes on common medications. It seems like you're all really interested in pharmaceuticals.
It's a fascinating world, isn't it? So many medications out there.
And we're going to try to make sense of it all, right? We're going to take a look at this alphabetical list of medications, kind of dive deep and see what we can uncover,
Yeah. Unpack some of this stuff, really get to the bottom of what these medications are all about.
Exactly. And today we're focusing on V and Z, based on this list compiled by Dr. Khaled Hassan. Shout out to him for the great research.
Absolutely. He did a lot of heavy lifting there.
Big time. So ready to dive in.
Let's do it.
All right. One thing that's super interesting, and we'll see this a lot today, is how some of these drugs actually pull double duty. Like they can treat more than one condition.
It is pretty amazing, right? Kind of shows you the interconnectedness of the body.
For sure. Okay, let's jump in, starting with V. First up is Valganciclovir, more commonly known as Valcyte. It's used to fight cytomegalovirus, or CMV for short, which is a virus that, get this, most people actually have but have no clue they're carrying.
Yeah, that's the crazy thing about CMV. You probably have it and you don't even know it.
It's like a secret agent virus hiding in plain sight. So tell us a little bit about this CMV and why we need to fight it with medication.
Well, for most healthy people, it's actually not a big deal. The immune system keeps it in check. But for those with weakened immune systems, folks who have had transplants or people with HIV/AIDS, it can become a real problem.
Oh, I see. So it's like it takes advantage when the body's defenses are down.
Exactly. That's when it can cause serious complications. And that's where antiviral meds like Valcyte come in. They're like the reinforcements,
God, that makes a lot of sense. So moving right along, we have Valpro Sodium. And it seems like it's got a bunch of aliases: Depakene, Depakote, Depacon. What's the deal with all these different names for what seems like the same drug?
That's a really good question, and it's something that kind of trips people up with medications. So you have the generic name, like Valpro Sodium, and then you have the brand names, which are given by the companies that manufacture them. So the active ingredient, the stuff that actually does the work, is the same across the board, but there can be little differences, like the inactive ingredients or how it's formulated.
Okay, so it's like same song, different artist.
Yeah, that's a good way to think about it. But what's really interesting about Valproate Sodium is it's actually used to treat two very different things: seizures and bipolar disorder.
Wait, really? Two totally different conditions. I mean, how is that possible? How can one drug do all that?
It's pretty wild, right? But if you think about it, both conditions are actually related to what's happening in the brain, specifically with neurotransmitters. Valproate Sodium, it kind of boosts this neurotransmitter called GABA, which actually has an inhibitory effect on brain activity.
Inhibitory, so it's like calming things down.
Precisely. So for seizures, it can help calm down that excessive electrical activity in the brain, and for bipolar disorder, it can help stabilize moods.
So even though seizures and bipolar disorder seem totally different, they actually share some common ground in the brain.
That's amazing. Science is so cool. Okay, next on the list, we have Vardenafil, which is better known by its brand name, Levitra. And this one, it's used to treat erectile dysfunction.
Yeah, so this is definitely a sensitive topic, but it's an important one. Erectile dysfunction can have a real impact on men's lives.
Absolutely. So how does Levitra actually work?
So Levitra belongs to this group of drugs called PDE5 inhibitors, which is a mouthful. But basically, PDE5 is this enzyme that controls blood flow. And by inhibiting this enzyme, Levitra helps to increase blood flow, which, can help men achieve and maintain an erection.
I see. So it's all about getting that blood flowing where it needs to go. All right, moving right along to Venlafaxine, also known as Effexor. This one brings us back to mental health medications, and it seems like we're seeing all sorts of different approaches to treating these conditions, right? Absolutely. There isn't just one way to address mental health. There are lots of different options.
An Effexor, it tackles it in a specific way, right?
Yep. Effexor is what's known as an SNRI. That stands for serotonin norepinephrine reuptake inhibitor. Basically, it stops these two important neurotransmitters, serotonin and norepinephrine, from being reabsorbed too quickly in the brain. This means there's more of them hanging around to do their job, which is regulating mood.
Gotcha. So it's like boosting the mood messengers. That's really cool. All right, let's shift gears to Z. First up, we have Zaleplon, or Sonata, and Zolpidem, better known as Ambien. These sound like the ultimate sleep aids, the dream team for a good night's sleep.
They're definitely popular choices for insomnia.
So what exactly are Z drugs?
Well, it's a catchy name for this class of medications specifically designed to treat insomnia. They work a bit differently than older sleep meds in that they, like Valpro Sodium, enhance the effects of GABA. And this difference, it sometimes leads to fewer side effects.
So it's all about getting that good quality sleep without the downsides. And speaking of medications that can make a huge difference in people's lives, we have Zolmitriptan, or Zomig, which is a real game changer for anyone who suffers from migraines.
Migraines are brutal. They're way more than just a bad headache.
Oh, absolutely. So how does Zomig step in and provide relief?
Well, Zomig belongs to this class of drugs called triptans, and these guys specifically target certain serotonin receptors that play a role in those migraine attacks. What they do is they constrict blood vessels and block pain pathways in the brain, essentially stopping that migraine in its tracks.
Look like migraine not today. All right, last but not least, we have Zoledronic Acid, which goes by the brand names Reclast and Zometa. And this one, it's another multitasker, right?
It is. It's all about those bones.
So how does Zoledronic Acid help keep our skeletons strong and healthy?
Well, it's a type of medication called a bisphosphonate, and these are really important for maintaining bone health and preventing bone loss. They help to strengthen the bones, make them less fragile.
So it's like bone armor.
Pretty much. And Zoledronic acid is actually used for both preventing and treating osteoporosis, which is a condition that weakens bones and makes them more prone to fractures.
So it's like a two-pronged approach to bone health. That's awesome. Well, we've gone through a whole lot of medications today, from fighting sneaky viruses to managing some pretty complex conditions. It's really amazing how intricate the human body is and how medicine is constantly evolving to meet those needs.
And you know what? This is just a tiny sliver of what's out there. There are so many medications being developed and researched. It's truly incredible how much progress is being made in healthcare.
It's mind-blowing for sure. And I think the takeaway for everyone listening is that we just skim the surface here. It's always best to talk to your doctor or pharmacist, get that personalized advice on what's right for you.
Couldn't agree more. There's no substitute for that expert guidance.
Absolutely. Well, on that note, I think we'll wrap things up here. Thanks for joining us for this deep dive into the world of pharmaceuticals. And remember, keep learning. Stay curious. Right.
That your body needs.
Okay, so wow, we've covered a lot of ground today.
We have, from A to Z, or I guess from T to T.
From T to T in this case.
It's amazing to see how these medications target such a diverse range of conditions, you know?
It really is, and it speaks to the power of modern medicine and pharmacology, right?
Yeah.
It's incredible what we're able to do these days.
Totally. And a huge thanks to Dr. Khaled Hassan for making this information so accessible.
Oh yeah, he's a great resource. His podcast is fantastic for anyone who wants to learn more about these medications that we encounter every day. So, I mean, I highly recommend checking it out.
For sure.
And for you, our listener, we leave you with this.
Ooh, a parting thought.
A parting thought.
I like it.
How many of these tea drugs have you encountered in your own life or in the lives of your friends and family?
It's a good question to think about.
It is. It's fascinating to consider how these medications are woven into the fabric of our health and well-being.
Absolutely. They're everywhere, even if we don't always realize it.
Yeah. So keep exploring.
Keep learning.
Keep asking questions.
Stay curious.
And stay curious about the world of modern medicine.
That's what it's all about.
That's what it's all about.
It's a fascinating world.
It is.
For sure.
So until next time.
Stay healthy, everyone.
Stay healthy.